Back in May, when we had around 200 new cases a day on average, we set a goal of our investigations and contact tracing operations to address 400 to 500 new cases a day by July 1st. The good news is that we hit that staffing early, and our goal was exceeded by June the 10th, when we were able to address over 500 cases a day. Our goal initially was to bring on 60 new public health employees. As cases have increased, we decided to bring on just over 100 public health professionals. As of today, we have hired 83 of those positions. We have also partnered with ASU, U of A, AmeriCorps Vista Volunteers, Crisis Response Network, and Banner Poison and Drug Information Center, all of which add people to help us reach out all of our COVID positive cases and their contacts. We've heard over and over again how much contact tracing is valuable in outbreaks. In public health, we use contact tracing early for a large number of infectious diseases. For certain diseases, it can be one of the most effective tools in our toolbox. For example, think of a person with a sexually transmitted infection. It is much easier for someone to recall their sexual partners so that we can reach out and do contact tracing with them, compared to a disease like COVID-19, which is spread when someone coughs, sneezes, or talks. Remembering everyone you've done these things with over a 2-week period can be difficult to recall, and you often don't even know them. In addition, we know that around 40% of individuals who are infected with COVID-19 are asymptomatic, so they may be spreading the disease without realizing it because they don't even feel sick. We are also hearing reports that with so many people getting tested, labs are taking longer to track and report all of the results back to public health. Public health can't reach out to people until we know that they are positive from the lab results, which makes our contact tracing efforts even harder. We are relying on people to get tested to stay home and away from others until they find out their test results and they no longer have symptoms for 3 days. With so many people in our community infected with COVID-19, and many of them not experiencing symptoms or not knowing they have COVID, it is important that we all assume that we could be infected and exposed when we are out in public. We still believe that contact tracing is one of the tools that we can use to help slow the spread of COVID in our community. It's important that people know they are positive, what to do when they know they are positive to prevent spreading the disease to others, and that people who are close contacts know how to watch for symptoms. That's why at Public Health, we are still doing our part. We are reaching out to every single positive case that we have contact information for within 12 to 24 hours of us receiving that test result. People who get tested and have a positive test get a text message from Public Health notifying them of their results and asking them to provide some information to Public Health. We are also working on adding an automated phone call to this process to help individuals who only have a landline. The additional information cases provide will help us to determine if they are high risk, like someone who works in a healthcare or child or school setting. This process allows us to prioritize cases who are at higher risk or come into contact with those who are at higher risk. As great as our process is, contact tracing is not a perfect solution. Unfortunately, around 15% of the cases we get come without any contact information. And only 5 to 7%, we never get their contact information, meaning that even after multiple attempts, we're never able to reach those individuals to give them their test results or find out who their contacts were. The best thing we can do now for our community is try to reduce exposures and slow the increase of new cases. Our commitment to you, the residents of Maricopa County, is to give you the facts about what is happening and what you can do. Everything we tell you is based on research and science. And here's what the science is telling us can help Maricopa County residents slow the rapid growth of COVID-19 cases in our community. First, practice social distancing as much as possible. Second, Wear a mask when you cannot keep at least 6 feet of distance. Third, wash your hands frequently, especially after you touch your mask. And finally, please stay home when you are sick. So while we keep doing what we can in public health side, we need help from everyone in our community to help slow the spread of COVID-19. And if you get a text message or call from public health, please respond to the survey. Responding to this survey helps us do our job in a more timely and efficient manner. Thank you.